Well, good evening. Welcome to XPC Talks. We're super excited to hang out with Ellen today. She's a product guru and we'll talk about buy versus build decisions. So Ellen, I'll hand it off to you. And if you can tell us a bit about your background and how you got into product, and then we'll kick off with your presentation.
Perfect. Well, it's great to see everybody. Great to meet y'all. So I'm Ellen Su-Marquez. I was most recently the Chief Product Officer at Wellings, which is a digital health company that was building chronic care management solutions for COPD. My career has been in digital health. So I started off as the CEO of a medical device startup. My background's in product design and really focusing on human-centered design, but kind of a broad set of skills. So I started off doing medical devices. Within that startup, we started moving into like connected devices and wearables. So I also was working on the design of the software side, both the patient software as well as the clinician facing software. That company got acquired by Wellings. Funny story, that company was called Wellings. And when we were acquired, the name moved over to the new company. So I've worked for two companies called Wellings and they've been different companies. So we were acquired, and then I joined the new team as their chief product officer. And at that point, we were also a device company. And then I basically helped manage the pivot from a portable nebulizer to a virtual pulmonary rehab and COPD chronic care management company during the course of the last kind of 4 years. So I joined that team in 2020, which was, I will say, an interesting time to be in respiratory care. And kind of through the events of that, we pivoted the whole business model as well as the product. So have had a lot of experience kind of growing teams in that environment, leading and building teams there, as well as diving into value-based care, specifically was where we were targeting. So we were targeting Medicare Advantage. And we had a software team, product team, operations and clinical teams. So being able to manage all of those different teams, working closely with them from a product perspective, and figuring out how do we build in that environment, and how do we best make use of the resources, and really focusing on like, what are we learning, what are we building, what is the market telling us, and doing that in an environment where there was both kind of feasts when in 2021, 2022, when basically VCs were throwing a ton of money at everybody really, to more famine where, we're seeing like CMS adjusting their reimbursement rates, value-based care kind of getting more scrutiny, a little bit of a contraction in that market. And so managing like, how do you really laser focus on what's important to the business there? So had a lot of buy versus build discussion. So I'm happy to talk through it with you all here. If you have any questions while I'm talking, please feel free to pop that in the chat and I'll come up to them as we go. And I know some folks had submitted questions beforehand, so I'm happy to kind of cover those as I go as well. All righty. And I'll share my screen so you'll see the slides, but I figured it'd be more useful to kind of ground it in some concrete examples. So I'll be talking through kind of my experience with Wellings, and then talking through some of the things that we encountered there, as well as some of the things that I'm currently evaluating. So today I'm actually a fractional chief product officer for a couple of companies in the early stage digital health space. So I've got two companies that I'm working with, one in the oncology care navigation space and one in the medically tailored meals space, and that's focusing on dietitians and nutritionists for Medicaid and Medicare patients. So both of those companies are very early, and so basically sitting in buy versus build conversations all day long. So happy to kind of talk through what that looks like from the very, very early stage perspective. All righty, let me share my screen. Okay. All right, can y'all see that? Perfect. And I'm going to pull up my chat window so I can see it.
And
Um,
then Ellen, hit full screen if you don't mind, if that works, and I can help you with the chat.
this one.
Let's see. Yep, we can see that.
All right. Oh, I see Misha's on. Hey, Misha. Alrighty. So, really the question here, buy versus build. I actually think it's a bit of a false dichotomy. It's not necessarily strictly buy versus build. I usually take a buy then build approach. And so really the mission here is you are trying to accomplish a certain set of tasks or functions with a limited set of resources. And so this is really what this question is really getting to. And so kind of going through the process here, let's see, okay, here we go. There we go. So going through the process here, talking through like, when do these questions come up? Why are you facing this decision? Like, what's the context behind the decision in the first place? Because if you don't have that clear, that can often send you down a path that ends up being, kind of the wrong place to be because you weren't really sure where that kind of started from. So it's really important to be clear, like, why are you running into this question right now? The second is, what are the factors to consider and what are all of the kind of options that you have on the table here? So what are the things that might influence this decision from, the importance of this question to the business to what are the resources that you have at your disposal. And then later on, it's how do you actually evaluate those options? So once you kind of get a read on what are my options, how do you compare options against each other? And then the fourth one is how do you measure success? So like, how do you actually figure out if it was the right decision or not? That's a little bit more retrospective, and that's going to be very much dependent on the company itself. So it's more about like, once you've made a decision, how do you set yourself up for success down the line? I like this diagram below, where you're kind of looking at your requirements first. You should always start with your requirements. So don't just jump straight into looking at solutions or ideating solutions. This comes back to a lot of like the lean startup methodology. It also comes back to the human-centered design process, where you start with the problem and you try to define that problem as best you can. If you don't do that first, a lot of times you'll end up solving the wrong problem, or you'll find yourself spending time and resources kind of chasing down features or functionality that you don't actually need right now. And when you're in a small early stage company, or when you're kind of starting up, whether it's your own practice or a digital health startup or a company, you don't have a lot of resources at your disposal, right? You are very resource constrained, and you have to be very scrappy. So, any week, month, day wasted, that's time that you could have spent kind of solving problems with the business. So this is where it's really important to solve the right problems. Um, so I'll show you guys one of the templates that I built for my team when we were doing a lot of our vendor evaluations. But these are kind of the rough steps of the process that we went through. So one is figuring out like, what's the objective? What's the business need for this tool or functionality? And how does that tie to our specific company objectives? Your stakeholders, who needs to have final input on this and who is the final decision maker? I saw a couple of the questions in the thread of, how do you find the key decision makers, and how do you build consensus? So that's a really important part of this, and we can definitely talk through that. It is going to be very business dependent. And then, I think some of the questions were coming from the perspective of a vendor who's trying to sell to a company that's making a buy versus build decision. And I think that's a really interesting kind of perspective to dive into, because your understanding of those stakeholders will kind of inform if you're reaching the right person, if you're reaching the person who actually has kind of control over that process. So I can give you a peek into like what it looked like from my end as a head of product. But I think that's important to be able to kind of understand that for who your clients are. If you in the situation are the vendor that's trying to, tip a company towards the buy side of the decision, for example. Use cases. So how will this be used? What are the highest priority use cases for this function or tool? Who are your options? Who are the vendors? And then if you're building it, what's the implementation plan if you build? Like, what are the resources involved if you're building it? And then your evaluation is like, how are you comparing all those factors? So that's kind of a brief overview of the kind of different factors that we use. All right. So kind of diving into the first part of that, when does this question come up? And I would love to hear from some folks, if you guys are running into this, what are some examples? So for example, we have, our clinical or ops team is running into friction in their workflows. So we have some people that are saying like, it's taking me too many clicks to do this, or I need some way to manage, I need some way to manage my tasks. Or I need to be able to send an SMS to my patients because they're not checking their secure message portal. So you'll get requests like that. You'll also find that like the market and customers are demanding new capabilities. So our sales team might be talking to a health system, and the health system says we have to be able to do this. Or we're hearing this like, okay, we love your solution, but if you could do X, Y, and Z, it would be great. You'll also run into this question if you're entering new markets for the first time, or if you're a brand new startup that's trying to find product market fit. So, it is like, we're just trying to launch into here, and we have this list of like, here are some core requirements that we have that we need in order to be able to launch into this new market. Do we build this functionality, or do we find a vendor that can provide it? A really classic one is, we need an EMR. Should we buy an EMR or should we build an EMR? The answer is almost never build an EMR. When you get into the do we buy or build an EMR, it's really what functionality do you want your EMR to perform? Because EMR encompasses like actually a very broad swath of functions. And it's actually more of an umbrella term rather than a single kind of piece of software. And so you have to actually unbundle it and actually figure out what is it that you need. Because sometimes it might be that you buy, quote unquote, buy an EMR, but you don't expect it to do everything. And so you have to figure out like, what does it need to be good at, and what can it be bad at that you can find another solution for. And then you have this case where you have scaling problems with your existing solution. So you might have something that's a manual process right now that you have like a human being copying, pasting information from one place to another. And you have to decide like, do we find a vendor that can do this, or do we build something that can handle this and automate this? The most important thing here is like, you're going to get a lot of these questions. Not all of those questions, and this ties into product management as a discipline. Not all of those questions are ones that you have to solve right at that moment. So at this point, you actually have to figure out like, is this a core problem for us to be solving right now in the first place, before you even get to the decision of do we buy, or do we buy something for it, or do we build it? So that's a whole other discussion on like, how do you prioritize what problems to focus on as a team? So, and I'm happy to talk through that at a later point, but at the end of the day, that has to tie to what is the objective that your company is trying to accomplish. And that can be, anything from like, there's something that we have to do this quarter that's fundamental to our business, or it can be like, we need to be able to do this within the year. And then you have to evaluate that against all of your other company priorities and what you're spending time on. And so, again, as a small early stage company, you are probably quite resource constrained. And so you have to figure out like, do I spend time on this now, or do I spend time on this later? Is this a problem that's going to face me to get, do I need to solve this problem in order to get my first patient in, or do I need to solve this problem when we have 1,000 patients, or when we hire our 10th, provider or clinician? Because those problems can wait till later. You probably need to solve the ones that are stopping you from bringing in your first person. So that's kind of a big one. I would love to hear from the group if you have questions that you're facing right now. Like, do any of you have current buy versus build decisions that that you're facing down right now? Aha. I see one question from Morgan for how would this change for health systems or providers? I think one of the things that changes in terms of like, do we need to buy versus build it? That is the big factor here is going to be more of what are the resources available to you. The main question on the priority side of things is, do you have clear directives from your leadership for this? So like, does the health system have clear objectives? Or from a provider standpoint is, do you know what metrics you need to hit for for payment, for example, or for like your revenue goals if you're running an independent practice? But yes, Morgan, if anybody wants to come off mic, feel free to add more context.
Hey, so thank you for the presentation, Ellen. This is
Mhm.
great. I think I'm thinking about it from the perspective of we are several primary care clinics working in full risk. And so we're a new company and we're often, surface with different challenges. There's options to buy some of these large VBC systems. We elected early on not to do that.
Mhm.
And so we've been going through a selection of choosing different vendors or
Mhm.
building integrations ourselves. I'm from the technology side of the house, so
Mhm.
this is
Mhm.
often something that I think often about, and like
Yeah.
whether or not it's like, is it worth it for us to invest our tech team in building this, or like, because generally as an engineer, I'm like, oh yeah, I can build it. Do I want to, or is it useful to build it? That's where we run into, and
Mhm.
I think that's kind of the lens I'm looking at it. So, for example, workflow management is a
Mhm.
tough problem. Often a lot of the payers don't have a perfect solution. And I guess that's where it's like, I guess again, how comfortable can you be if it's potentially really impacting the bottom line in terms of like your quality outcomes or your documentation outcomes?
Yeah, so I think that's a big one, right? So you identified workflow management, and the question back is like, is the lack of that tool right now, or the lack of that functionality, causing problems, or is it something that you're thinking like this will become a problem? So that's kind of the first one: is this a problem that you have to solve now? And let's just say it is. That kind of takes us to our next piece. So, and this piece is really like, it's really for the leadership. The is this the right problem to solve? Because sometimes people will say like, we need to get a vendor for this, and the answer is actually like, we don't need to solve this problem right now. But if we move into, is this the right problem to solve? This is the right problem to solve right now. For buy versus build, one of the first things that I ask is actually, is this feature something that you need to do to check the box, or it's a nice to have, or is this feature something that is a core competitive advantage to the business? So so e-prescribing, which someone had thrown out as an example. For a lot of companies, e-prescribing is a functionality that they need to have. Like, we need to be able to prescribe, but it's not necessarily core to their business. So for example, in my company, we needed to be able to prescribe, for example, like corticosteroids for folks, or emergency kind of inhalers. That wasn't a core functionality of the business. The core functionality of the business was the ability for our health coaches to be able to see a lot of people, to keep track of them, and to suggest the right thing at the right time. So doing a lot of clinical decision support, and working with patients longitudinally. And so for us, e-prescribing was a very clear buy decision because we knew that one, it's a very complicated, it's a relatively complicated thing to build. And two, there are solutions that exist out there. And then three, it wasn't a critical kind of core functionality for us. If it is a core piece of functionality for you where e-prescribing, like, your company being better at e-prescribing than anybody else is what gives you a competitive advantage, that's a case where you might build it, even though, some solutions might show up there. You might need to have more control over that process, right? Like you might say, like, the implementation that other companies have isn't going to be good enough for what we need. Workflow management is another one where there are workflow automation tools. You have to figure out, like, is workflow automation something that's core to our business, that helps you meet like efficiency goals, or is your clinical decision support process, is that core to your goals, or is that something that there just needs to be something good enough there that lets you say we can do this? Does it meet like a check the box? Some of those types of questions are like a one thing that we ran into a lot is we would talk to an insurance company or a plan, and they would say, like, we need a clinician portal. Like, we need a clinician portal to track like device readings. And we knew that clinicians would never actually look at it. Like, nobody's signing into a third-party portal. And so one of those is like, we actually ended up pushing back and saying, like, we don't need this. Talk to your doctors. They will tell you that they will never use this. But what we had selected was also a vendor that could basically just be like it was just kind of like a dusty corner where they had a portal, you could look at data. It was not something that we wanted to build, even though it would be easy enough for us to build. But there were a bunch of like RPM platforms that we could have bought that had that functionality. We managed to push back enough to say that we don't actually need this, but that's where we would have gone if we had done that. But in those places where you have to be better than the rest, that's where you should be investing your engineering effort, because that's the part that you need to control. Yeah, looking at Misha's comment. So, buying, scheduling, and membership management. Yeah, scheduling, classic. Like, you do not want to be a calendar management system. That is probably not your like thing that you're advertising to everybody. Now, is there a perfect scheduling system? No. Scheduling, everybody has problems with. Nobody's really figured out how to solve it, but also you do not need to be the best in class at scheduling. So that's something that you can buy. It'll be a little bit painful. Your clinicians are going to complain about it. Your engineers are going to complain about it. The APIs aren't going to be like super well supported, but it will work fine. And across the board, everybody hates their scheduling. So that's one where buying it is okay. I think we have a hand raised.
Is it okay that I unmute, Paulius?
Yeah.
Okay. Hi, this is such a great conversation, Ellen. Thank you so much for your insight so far. My question is centered around policy. So certain, features or core features, I think, let me give you a bit of a background. I'm the CEO of Wellness Wits. We build we have a software for group visits where doctors can see multiple patients at once. And so we are at this moment the only software, as far as I know, that is specific for shared medical appointments, group visits. And so we've had to figure out a lot of things that were either necessary or not necessary to build. And we've had to buy certain things. But then there's different policies out there for different payers on group visits. And we've just tried to adapt to the main ones. That's CMS and Blue Cross Blue Shield and the other large payers. And we've come to a crossroads where we feel like certain features will potentially need to be built for us to remain competitive. But then we're concerned about policy changes in the future for telehealth CPT codes, right? Because some of the things that we're doing in groups are also chronic care management services and also remote patient monitoring. So my question is is it wise to wait out some of these policy changes and see how they, meet our own core functionalities, as to say, okay, if we build this thing, do we get more reimbursements for certain services? Or if we buy it, does it mean that other people would go from our platform to go buy from other people rather than us because we don't have that functionality?
I think that really does depend on your customer. So from a standpoint of policy risk, I think that's where you have to figure out, like, is that policy risk something that you want to take on, right? Like, is it a competitive advantage for you to stay ahead of those policy risks? Like, you will have to keep track of those policy risks. But one of the selling points that you can say is, we keep track of those policy changes and we help you kind of meet these new policy changes, and we're adaptable enough to do that, and we're more nimble than what's out there. So like that can actually be a competitive advantage, where you lean into that and you actually put dedicated resources behind, one, keeping track of those, and then two, understanding the implications of those policy changes and making those changes yourselves in your product. So that, I think, is but if that's something where, that's both a risk and an opportunity, I think, for your company. On the flip side, your question about, like, if we buy that, would someone else potentially want to buy that directly from someone else? One of the factors that I have kind of bringing up later is, like, what's the switching cost and what's the cost of having multiple platforms? Because at the end of the day, and especially in big institutions that you might be selling to, and this is kind of touches on the questions from previously, about, like, how do you find the right decision makers, and what do companies look at when they're looking to, like, if you're the vendor and you're trying to sell, a big piece of it is, like, how many problems can you solve at the same time? Because doing a vendor evaluation is expensive and time consuming. Doing an implementation is expensive and time consuming. So if you can bundle several other features, even if you don't have all of the features, the company, the customer that you're selling to might still stick with you because you solve more of their problems, and they're okay with waiting for you to kind of solve that next problem. So for a very specific example, there's a lot of digital health companies that kind of target this market of, hey, Epic doesn't do this feature, and, like, we can move faster and we can implement these kind of better functionality. But what you'll find, and there's a great graph about this, I'll track this down and post it, but basically, like, your solution has to be 10 times better than Epic's implementation of it in order for people to even consider switching, because there's this kind of thought of, like, there's this platform capture effect that's going on, especially within the EMR, where it's like, even though, your process might be like 10%, 20%, 30% more efficient or capture more revenue, the fact that someone has to leave their tab open, like they have to leave their software, or they risk getting signed out of Epic, that drives a lot of behaviors. We also ran into this because we were focusing on COPD, and so we were a point solution for COPD. Even though, like, we would go to Medicare Advantage plans and we would try to sell them on our solution, and they would have an RFP out for a COPD solution. And they loved what we had. They loved our clinical model. But at the end of the day, they basically said, any new implementation costs us $1.5 million to just, like, implement. It takes us 7 or 8 months. We would rather wait for our partner who's done our diabetes solution to put in place a very, like, subpar COPD implementation, because we know this vendor and we don't have to start a new process to bring them on. And so you can actually flip that around and use that to your advantage, where if you can cover multiple bases and kind of become a platform solution for your customer, then they're less likely to go out and look for a different vendor. And then you can kind of build for that. Yes. Also, I'm seeing some discussion in the chat about scheduling solutions. That is one thing where that's, I think, a very good example of a buy then build, where yes, there are scheduling solutions out there. Nobody loves them. You can start with them to just get basic functionality of like, I need someone to just be able to like connect with a Google Calendar, pick a time, put something on there. And then as you grow, you realize like it can't handle, multi-state, multi-licensure. It can't handle, a lot of the rules that you need to put in place. But you were able to have something in place to just start taking appointments. And now okay, here's the complexity, here's the full complexity. Now that we've had a lot of patients come through, now we're going to build our solution. And so that's, I think, a place where the buy then build can help you de-risk and learn a lot from your first set of patients, and it lowers the barrier of entry to getting that function. And then if the switching cost isn't too high, you can then basically build your solution and improve upon it. Rather than spending a lot of time building out the gate without having real patients to learn from. All right. One kind of next piece here, once moving on from is this core to your business, is what are the resources that you have and what are the resources that you want to invest in? And I put the photo there because it's the classic, like once you have a hammer, every problem looks like a nail. Once you start hiring engineers, unless you have a very, very like disciplined head of engineering or kind of tech advisor, everything becomes we could build that. And a lot of times it's like, I would rather build this because I don't trust any other engineer or engineering team. Yeah, so a big piece of this is what does your business look like at scale, right? Like, does it look like you consistently building software, or does it look like you having like a really great operations team that can really focus on process? So this ties again to like, what are your key business objectives and where are your core competitive advantages, right? So like, if your core competitive advantage is your clinical intelligence, for example, or if it's like clinical enablement, it's having really great clinicians, it's training them to deliver really great care, and it's getting out of their way. That might be where you have a lighter weight engineering team. But if your core advantage is something where it's like, we learn a lot about our patients, we are able to kind of like suggest better kind of treatment options and personalized treatment, then you might invest in, say, like a data science team and a team that can actually take the data that's coming in, and you might actually need to instrument more of your solution to be able to collect more data from interactions, for example. If your kind of key kind of competitive advantage is not something that is building your own technology, then it doesn't make sense to build, because then you have to then maintain it. You may be paying a contract engineering firm to build it, and then you're left with kind of this piece of software that you have to constantly maintain. And so if you don't want to do that, then it might make more sense to buy something, and you're kind of beholden to that. But it means that your long-term operating costs, you don't have to have engineering built into it. So managing engineers, it is, it gives you a lot of options, but it also does come with its own downsides and risks. So that's another piece of, what you might want to consider for what your long-term team makeup looks like. And then another piece is, what's the scale of the decision? So, what's the impact of getting this decision wrong or right? So you might be, this might be something quick and dirty. So to give an example, we had to build basically like an admin portal for our database. And we basically, like, it was like a solo engineer was just like, I'll just put something together, in a couple of days just so we can get visibility into this. And, it was like, okay, we'll use this for 2 months and then we'll kind of build a more complete solution. So it's like, we'll use something out of the box using Rails, and then we'll build a more complete solution. We ended up using that like quick and dirty duct tape together solution for about a year, which I think is always what happens, is like, okay, we'll build something quick and dirty and we'll use it. That to me was a perfect example of, we learned a ton from that. And yes, the engineers hated it. They hated that we were using this portal to do this, but we learned a ton. And when it came time to actually build it from the ground up with best practices and in a way that actually fit our data model, we were able to get it right. And that was when we had, and so this like small scale thing that we had when we had 100 patients to manage in this kind of list, that worked and let us get our first patients in and let us kind of do our first set of workflows until we got to 1,000+ patients, and we actually needed a more functional portal to manage things. So then we were able to move over to a system that worked a lot better for managing it. But it basically allowed us to problem solve those first things and really understand what was important, because there were a lot of features that people wanted to include into that first version that we just said like, nope, we're going to do it quick and dirty. Those features actually never ended up being useful, and we're really glad that we didn't spend the time to cram everything into this original iteration. Oh. All right, let's see if my slides will go. Okay, so that was the message. A couple of the buy factors to consider. So when you are kind of thinking through these factors and you're thinking, do I buy or build? Oftentimes it's useful to consider both options, right? So you want to know what's out there before you decide one way or the other. So you will probably have to do a vendor analysis. There's a lot of really great tools out there. Highly recommend Elion. They do a lot of work to kind of help you compare different vendors head to head. And they also do a lot of work to collect reviews from folks that have actually used it. One of the big things here is like, what does ongoing support look like? You don't always know that from talking to the sales teams or looking at the marketing websites of these vendors. It's actually really important to talk to people who've used this vendor, because sometimes you'll find like, oh yeah, their sales team is fantastic, but their like account management team sucks. It's like, we signed up, they were super, like they promised the world, and then when we signed the contract, they didn't respond to us. That is more common than you'd think. And it is unfortunate when that happens, because you don't have the time to redo that effort. So let me just pull up Elion. So yeah, so I highly recommend services, and you can search like G2 or some of the other like vendor comparisons. The problem with health tech is not all of those like classic software vendor categories will show up in a Google search. And a lot of these are so early that you don't get to see them. But again, highly recommend Elion to see, they have categories, for example, where you can look at all of the AI ambient scribes, if it'll log in. Oh, odd. Well, let's see if I can sign in here. Highly recommend using tools like that to help you like do your evaluation. So one thing, for example, with Elion is we were looking at kind of a new EMR. And one of the things that they sent us was, basically we sent over our list of like, here are the 5 that we're looking at. And they sent over basically 14 like in-depth reviews, 2 or 3 from each vendor that we were looking at, of like real product, clinical, engineer feedback of implementations with each of those platforms. So it was incredibly helpful for us. Let's see. All right, I'll get that loaded and send and show you guys in a sec. One of the big things here is what's the integration cost and what's the switching cost. So there are some items that are easier to switch back and forth from, and there are some that are harder to switch back and forth from. So for example, if you think about an EMR, it is hard to switch off of because there's so much data that goes into it. But something like, let's say one of the ones that we did was for an integration partner. So we were looking at like Zeus and Redox and Health Gorilla, Particle Health, because we needed an on-ramp to Care Quality and Commonwealth. That is a pretty straightforward implementation, and the data that you get from each of those is pretty standard and straightforward. And so we knew that the switching cost was low. So for us, it wasn't, we were basically able to focus on price, because we knew that like if we wanted to move from one vendor to another, it was not going to be a huge lift. Versus if you want to move from one EMR to another, that is a huge lift. So that's a big factor that not a lot of folks necessarily consider, because you need to spend more time with the vendors that have a higher switching cost. The other thing to look at is what happens if you have more or less usage than you planned, and what that pricing change looks like if that happens to you. So I'll show one of our vendor evals for a 24/7 nurse triage line. If that loads. All right, here we go. So for example, and this is the actual document that we use. So I'll zoom in a little bit so you can see it. So we basically so we had our kind of business need for the tool, and we tied it to ED admits, right? So we wanted to basically divert ED admits, and so we wanted them to call the nurse triage line first, so that we could basically offer more advice and support, especially after hours. We had our stakeholders and our use cases for that. Our use cases, so one, we needed to know coverage, how they handled the episode, their reporting and data, and how they handled kind of adoption of the triage line. So those were the big factors that we looked at. It is really important to get those use cases down, because one thing that'll happen is like if you're doing a vendor analysis on the buy side, people will try to sell you on features that you don't need. And so you really should look at the pricing to say, what are we paying for that is not actually functionality that we're going to use? Because that's a huge thing. They might be great at what you need, but you might be paying an extra like $300, $400, $500 per month or per year, because their primary use case, or they're bundling in a lot of functionality that you're actually not going to use. The other kind of corollary to that is, what is this company's mission? Like, do you look like their other customers? Because if so, they're more likely to consider your feedback as important, and their roadmap is more likely going to align with the features that you need. If you don't look like their other customers and you're not in a customer segment that they are focusing on or looking to expand to, you'll oftentimes get poor support, or you'll find that their roadmap diverges. So the way that they're developing doesn't necessarily account for your use cases. So that's kind of a side thing to evaluate, is like, are you aligned with how this company is selling themselves and who they're targeting? And then, what are your integration needs? So here is, we have some, fill these out. We had some regulatory and risk requirements, but not many here. But we did have our list of options. So we basically, looked through, talked to a lot of folks. We collected this list after talking to people, searching online, looking at some of these different vendor directories. And then we set up demos and evaluated. So within that, I'm using Notion here. What was nice is that I could keep track of like all of the different meetings that I had for each vendor. And then I basically compiled this list of the features that we needed, that were kind of culled from our list of use cases, as well as what happens at different scales, right? Like, what's the cost if we are looking at, 500 calls a month, 1,000 calls a month, versus 25 calls a month, knowing that we're starting with 25 calls a month. So that was a big one for us, was how does that cost scale and what's the difference in that? So we ended up going with the one that was more expensive. Actually, it was just more expensive across the board. but a lot of their other their pricing model wasn't going to be too much more expensive, but a lot of their workflows fit in really well with the workflows that we had. And their analytics were really important for us. So it was important for us to get analytics on how they were handling those calls. And so that's what tipped it over. So that was one of the evaluations that we did when we were comparing head to head on who to go with. And then back here, so those were some of the factors that we were considering when we were looking at the buy part of it. And then when we were looking at the build, this one we looked at where we did actually do a very quick costing out for 24/7 nurse triage, and we were able to learn from some of our employees that had kind of gone through that before. So, for example, our chief medical officer had worked in a different company that had built their own 24/7 nurse triage line. So they hired 3 nurses with compact licensure and basically had them scheduled out for 24/7 coverage to take on the phone calls. And one of the things that she learned there was, they got maybe 10 calls a month. And so it was something where, your cost there is that you have to have the phone lines, you have to have the training, and you have to hire those nurses and you have to staff them. And so when you cost out the staffing of those nurses, and then you compared that against the anticipated number of calls that we were looking at, it really didn't make sense to build that. But a different functionality that we had was our data analytics. And so for that, it was really important that we had all of the different vendors that we had, plus our own internal applications, all funneling into the same data lake. And then we had to build our own dashboards. And there are services that let you build those dashboards and that will help with some of that. But because of the complexities of the amount of kind of different places we were getting data from, that we decided to build, especially because we viewed that as a core critical component of our system, was the data in there and what we were learning from it. And so from that, we figured out like what are the resources that we need to have internally. So we actually ended up turning one of our product managers into focusing solely on like building out the data lake and the infrastructure, and having engineers like data scientists and data engineers that were focused on that. We also ended up bringing on some additional contract support to actually help stand up the data lake and basically do that initial build. So we basically hired a data engineer who could handle the maintenance of that data lake, and then we hired a contract firm to build the initial infrastructure. So, that was one of the things that we had to cost out. And we had to build out that whole budget and plan for like, here's what the initial build will cost with the contractors, and then here's what that ongoing maintenance will look like. Which is why we ended up, kind of with that combination of 1 full-time employee, 1 kind of contracts build. And then a big piece of that is what are the support and documentation and training needs? So one of the things that you run into when you build your own software is that nobody's bailing you out if it's not going well, right? Any problems with it are all down to you. So that is one of the factors that we looked at. So, you have no one to yell at but yourself if your system goes down or if something doesn't work right. And there are some places where it is nice to be able to point fingers at someone else and say, like, you need to fix this. And also it's nice to have someone who is maintaining documentation, because otherwise, if you're building something, for example, for clinicians to use, you have to create all the documentation for that. You have to create all the training for that. You have to work with your kind of operations folks, your ClinOps folks to actually train everybody on that. And when you make updates in software, to that, you also have to create the training and the documentation and the internal kind of release notes for that to your own staff. And so sometimes you don't actually want to deal with that, especially if this is a system that is, that is going to have a lot of documentation needs. So that also may be another factor to consider in terms of the ongoing support costs there. It's probably not your critical like core factor, but it might be something to think about. Another thing is how frequently is this going to change? So for example, if you have a function that you think that you're going to be iterating on frequently, that can be something where you might want to build that because you have the staff, you have the resources, and you're iterating on that frequently enough where you need to have these tight cycles of build, measure, learn, build, measure, learn. Versus like a vendor where you're kind of buying a stable product, right? Like you're buying a set of functionality, but you're not necessarily putting your eggs in the basket of like, they will build this future functionality. And so that's one place where if you know that you need something to develop and evolve as you go, you might want to kind of focus on the build piece of it, because you have more flexibility there for that learning and measuring piece. All right. That's kind of more of our consideration factors. I know we're a little close to time, so I'll talk very briefly about measuring success. And then I'll talk, and then happy to kind of take more questions as well. So with measuring success, usually by the time you've made that decision, like you also want to put in place a expiration date on that decision where you reevaluate. So if you say, and a lot of times in a buy decision, that's your contract term. So if you're working with a company and they say like, okay, you're subscribing for an annual plan, or you're contracted and you're locked in for 3 years, like that's a built-in reevaluation period. But you should be consistently looking at it. One thing to do is like in your product reviews, whether that's on a quarterly basis or on kind of like a twice a year, biannual basis, is to take a step back and say like, are we meeting these company objectives, and looking at like, are the tools that we have supporting those company objectives? And one big thing here is being able to cut things or leave things behind when they're not serving you. There's a lot of sunk costs fallacy in product organizations, or especially in healthcare. There's a lot of sunk costs where it's like, we spent money to build this, or we've already signed up for this. So we have to keep using it. As a small company, and especially if you don't have a ton of patients, don't throw good money after bad. Again, you are extremely resource constrained. You should be willing to make that switch. With the caveat of as long as your switching cost isn't too high. So for example, as long as you don't have to retrain all of your staff, or as long as you don't have to ask your patients to all have to do a multi-step process to shift over. So that's one of the places to look at. The other piece is, how is when you look at your vendor analysis, I would say quarterly or biannually, it's did they actually meet the requirements that you laid out when you initially did your vendor piece? Now, once you're locked, like once you've signed up and once you've locked in, if they're meeting it like 80%, that usually doesn't meet the threshold of like, we need to switch. But if they're kind of like 50% or less in meeting the promises, or the promises that they've made, that's when, you basically put them on probation, and you either like get them to commit to additional support, or additional resources, or you start building your exit plan. So you start figuring out like, how do we isolate the functionality of this vendor? How do we kind of insulate ourselves from that switching costs? So if you needed to do like a lift and shift, how do you reduce the risk of, if this vendor goes out or they go kaput or we stop with them, we aren't putting ourselves in a position where we lose access to data or functionality or patients. So that's kind of things to consider when you're already building. It's like, none of these decisions are really permanent because the situation and the underlying assumptions that underpinned it when you started that might change in the future. Even though, we would love to not have to think about these decisions once we've made them, but essentially everything is up for grabs. But that's kind of short notes on implementation. But essentially it's like you do need to build in times where you're reviewing the performance of your vendors or the performance of your internal tooling. So that's a big one. You will wait too long. That's just like a truth of the matter, is like you will wait too long to do that. And if you haven't waited too long, you are probably focusing on things that aren't important. So it's like things will get painful. People will, like, the duct tape will start to like peel at the edges. That is actually the right time to be moving, because if you're anticipating those kinds of things, there's probably other more important things that you should have fixed earlier. But it's kind of a constant process of building the plane as you fly it and identifying like what part is going to fall off next, and like catching it right as it falls off. So it's a lot of like just in time fixing in that process.
So Ellen, I'll just maybe make this a good place to stop. And I'll pause the recording, and whoever wants to stick around for more candid conversation, we can. And I'd love to take our usual photo with the group. So please turn on your cams. Appreciate that.